I always love a week or a month that will help to raise awareness, and this week is National Pain Week. So during this week, we're going to be talking about conditions that can have an influence on headaches and migraines, and also how headaches and migraines can interact and influence these conditions. And so today we're starting off with fibromyalgia. Fibromyalgia is a chronic condition that creates multiple regions of pain throughout the body in the musculoskeletal system that is usually more of a dull, consistent ache type of pain. The pain can certainly vary in intensity from a lower grade pain to a higher grade pain. General fatigue, sleep disturbances, cognitive disturbances, and strong brain fog are also quite characteristic of fibromyalgia. Fibromyalgia can be quite difficult to diagnose because the signs and symptoms do look like other things, and other things do need to be ruled out first before a diagnosis of fibromyalgia can be ruled in. And there are actually no tests for fibromyalgia, so it is actually a diagnosis of elimination. So although they don't actually know what causes fibromyalgia, they do know, or they do believe that a part of it is central sensitization. So in this instance, then we've got signals that are coming in that normally wouldn't be painful, or alternatively normally wouldn't be that painful, being registered as being much more painful than they should be. So hyperalgesia is when you've got a painful stimulus that's then being registered as being much more painful than what it should be. And allodynia is when you have a non-painful stimulus being registered as being painful. So sometimes this can just even be your shirt rubbing against your neck and then it being registered as being painful, or even the wind blowing by and then you registering that as being painful. This whole process is central sensitization, and this hyperalgesia and this allodynia are also experienced by migraineurs, and also those with chronic headaches. So in those that have fibromyalgia, then we do tend to see that there is an increased incidence in headaches and migraines. There are two proposed pathways for those experiencing headaches and migraines and fibromyalgia to explain why there's an increase in headaches and migraines. One, those with fibromyalgia, because they're in pain and discomfort and tending to move less, then they do tighten up and stiffen up in through their neck and their shoulders, therefore increasing their muscular tension and increasing their dysfunction in the joints in through the neck, and therefore it leads to an increase in headaches and migraines. Therefore, to help that, then we treat the neck so that we help get it healthier, and therefore we hope to see a decrease in headaches and migraines. Also, in those with fibromyalgia, we do tend to see that certain areas in the body do tend to be weaker. So by strengthening areas in the body, we do tend to see that there is a decrease in generalized pain in areas, which can be fantastic. The second proposed method is that due to this central sensitization, we've got to try to calm it down by things like sleep, diet, exercise, and stress to try to calm it down to make changes.